Right, good morning, everybody. Deidre and I are very happy to welcome the Andrea Barton Reeves fan club here to State Capitol. And all for a really good reason. I'll tell you what that means in a second, but I want to just talk to you broadly about health care. I think after 2.5 years of COVID hell, we know how important universal, quality, affordable health care is for every one of our citizens. I know how important it is for small business. I know how important it is to taxpayers as well. And getting that right is, priority number one. And one of the things, I've found in state government is we do have lots of different departments doing amazing work. Sometimes we could do a better job of working together and making sure everybody is rowing in the same direction. And so with that, I wanted to announce that Deidre Gifford will be leaving DSS and taking over Office of Health Strategies. And from that position, she'll be taking overall responsibility for all of our healthcare initiatives across all the different departments here. That's DDS, and DEMAS, and DCF, and Department of Public, there's all the Ds, and Veterans Affairs, and making sure that we use all of our market clout as a state to make sure we get quality, affordable health care for all of our citizens. She just came back from meeting with her counterparts from a lot of different states as well, and find ways that our states can work together in coordination when it comes to holding down the high cost of health care, holding down the high cost of pharmaceuticals, working together as one. And I think Deidre will do an extraordinary job taking the lead there. I got to know her, first thing every morning, end of every day during those 2 years of, COVID. I seemed to call her up right during breakfast, right when her husband's get the Waring blender going. So we'd be yelling about COVID with that in the backdrop. And she did extraordinary work, making sure that we could get our state open safely. And I want to build off of that coordination going forward. She'll be picking up from Victoria Veltri, who decided to move on from Office of Health Strategy. Vicki was an extraordinary leader for us there. And, Vicki in particular, I love what she does, what they call in the state government benchmarking, but it's also you got to have transparency. You got to have data. You've got to know what things cost. My hip can cost a lot more over there than it does over there, and it can be much better done here than there. And I want people to know what that is. And that data will allow you as consumers to make better decisions, and us as healthcare providers for our state employees and beyond. That's what the Centers of Excellence are all about. That's what they're trying to do over the Controller's Office. And Deirdre is going to try and work very closely with the private sector as well, so we can get people to where they get the most value on health care. And Vicki and her efforts with the benchmarking make a big difference there. Kim Martone stepped in for us when Vicki moved on. I want to thank her for amazing efforts as well. All right, so I know Deirdre can do many departments at the same time. She's done it before, but I want to make sure that we have the best direction for DSS, Department of Social Services. And so part of that healthcare cabinet, lead person of that's going to be Andrea Barton Reeves, taking over as Commissioner of the Department of Social Services. And I think her track record speaks for itself. I mean, you know what she's done over at HARC and managing there for folks with special needs. I asked her to come in and take over a startup called Paid Family and Medical Leave. It's a $400 million startup from a standing start. I think she knows something about management. Now we're almost a year into it. She's got it done. She's got it done on budget, providing an amazing service for thousands and thousands of people. And that's not an easy thing to do. And so that said, I think she's the ideal person to make sure when it comes to Department of Social Services and working with Deirdre, making sure that we have quality health care available, making sure we're working, with the nursing homes, doing everything we can to make health care, which is a basic human right, possible for every one of our folks in the best way we can from an affordable and value point of view. And just like If you could, Andrea, just say a few words about some of your thoughts on DSS and what you've learned coming out of HARC as well as Paid Family.
Thank you, Governor. I want to thank you, Governor, for this opportunity, and I am really humbled to have been nominated and to have the chance to continue to serve the people of Connecticut. And thank you, Commissioner Gifford, for all that you've done in your exceptional work in bringing a vast array of services to the people of Connecticut in really one of the most trying times that our city and our state, I should say, and our country and the world has seen. So you've done exceptional work. I'm grateful to have had the opportunity to bring Governor Lamont's vision of paid family and medical leave into reality for Connecticut's workforce. And to have done so actually with an extraordinary team of talented people is really more than I could have ever hoped for. And I really want to thank them publicly for their exceptional work in the last 2.5 years. I would also like to thank the Board of Directors of the Paid Family and Medical Leave Insurance Authority because their support was essential in all that we were able to accomplish. I am deeply committed to public service. I have worked in this space for over 22 years. So the opportunity to serve as the commissioner, the next commissioner of the Department of Social Services will allow me to lead and work alongside a talented workforce that continues its commitment to delivering a complex array of services to over 1.6 million people in this state. I have seen firsthand through all of my work in the last 22 years the enormous impact that DSS has on the citizens of this state to allow them to live and work and not be hungry and live with the dignity that every citizen in the state deserves. So I look forward to guiding DSS in its next phase of growth and delivery. I would also like to thank my family, my husband and my son, who have been stalwart supports, and all of the friends, and the governor joked earlier about my fan club, but I am able to do what I do because I'm an extraordinary group of women who support me and lift me, and I'm grateful to them, and thank you. Thank you again, Governor, for this extraordinary opportunity, for the confidence that you have in me and my ability to lead this agency in this critically important work for the people of the state of Connecticut. Thank you.
Without further ado, let me reintroduce Deidre.
Thank you, Governor. Morning, everyone, and thank you, Governor. Delighted to be here for this announcement this morning. Let me begin by congratulating Andrea on her appointment as the next Commissioner of the Department of Social Services. As you heard her say, it's a critical agency that provides critical services to over 1 million Connecticut residents. It's an agency that I have come to love over the last 3.5 years and that I leave with some sadness. Importantly, we're welcoming Andrea to a team of Human Services Commissioners, as you heard the Governor mention. And we really look forward to working with you as you take on this new role. Her background as a service provider and her strong commitment to the mission of DSS, as well as her management skills, are going to be a tremendous asset for the department, and I am confident that I'm leaving DSS in very capable hands. I'd like to also say a few thank yous, if I could. First of all, I'd like to thank the about 1,500 staff of DSS for their work over the past 3.5 years. They are hardworking, dedicated public servants. They work every day to make sure people have good health care, food on the table, heat in their homes, and so much more. I watched that team figure out how to continue to provide those services during the height of the pandemic, and I am very proud of the work that they have done. In particular, I would like to recognize by name 4 people who have supported me. They are Kathy Brennan, Deputy Commissioner, Mike Gilbert, Deputy Commissioner, Astrid Farrenpool, the Chief of Staff, and my assistant, Abby Cotto. When the Governor asked me to lead DPH, during the pandemic, those 4 really stepped up and filled in a lot of the gaps that were left at DSS, and we could not, as a state, have continued to do the work without their dedication. They are public servants in the truest and best sense of the word, and I really thank them. Mike and Kathy are trying to retire, but we're doing everything we can to not let them. I'd also like to thank Kim Martone, who stepped up as interim executive director at OHS after Vicky's departure. She has tremendous experience, and she's done a wonderful job of keeping the train moving and all the important initiatives moving at OHS, and we're grateful to her for her service, and I look forward to working with her in my new role. And finally, I want to add to the governor's comments about Vicki Veltri. Vicki, as you know, was the initial executive director of the Office of Health Strategy. During her tenure, OHS made really significant strides in advancing health care in our state. Whether it's the health insurance exchange, the primary care roadmap, or the healthcare benchmarking initiative, Vicki has left a very, very strong legacy. She set a high bar for me, and I really look forward to continuing her work. When the governor asked me to lead DSS, he made it clear that he wanted to see Husky and our health system move in a new direction in Connecticut. We have a strong and high-quality Medicaid program, but there's work to be done on our payment and on our quality initiatives to ensure good value, health equity, and better outcomes for everyone. I'm proud to say that under the governor's direction, we have moved down that path, but there's more work that we can build on in the second term. We've also put, under the governor's direction, DSS on a path to better digital access for our residents, making it easier for them to apply for benefits and keep the benefits that they have. Our systems can be old and complicated, and we're working hard to modernize them and make it easier for people to get the benefits that they need. The governor also recognized and asked his commissioners to work together to solve problems. There's no area where this is more important than health and health care. So he's asked me to work with his office, with OPM, and with my fellow commissioners to ensure that we have a coordinated and strategic approach to improving health care and health equity in Connecticut. I am so honored and privileged to work with the group of HHS commissioners in Connecticut, including Amy Porter, Nancy Navarrete, Vanessa Durantes, Jordan Sheff, Manisha Jutani, Beth Bai, Tom Sadi, and now Andrea Barton Reeves. I'm glad to add to that list. So as I transition to this new role, I will continue to coordinate across the HHS agencies to address some of our most pressing problems. But I'm also very excited to be able to carry on the work that's been started out at OHS. The work is really foundational to ensuring a high-quality healthcare system. The statutory role of OHS is to develop and implement a comprehensive and cohesive healthcare vision for the state, including but not limited to a coordinated state healthcare cost containment strategy. That is work that I very much look forward to taking on. So I want to thank very much Governor Lamont for the confidence that he has placed in me in taking on this new role, both at OHS and in coordinating with our healthcare partners. There is nothing more important to us than, as he said, working with our partners across the healthcare industry to make healthcare higher quality and more affordable in Connecticut. We are going to need partners all across that industry. We need hospital partners, we need physician partners, we need business and employer partners, health insurance partners, government advocates, and consumers, all of us working together. And I think the Office of Health Strategy is very well positioned to lead that work, and I look forward to getting started. Thank you, Governor.
Any questions for Deidre?
Sure. I'm going to invite you to set expectations. The issue of transparency in healthcare pricing has certainly been of public concern, at least going back to the Obama administration, maybe earlier. So what are reasonable expectations for what the state as an actor in this area can actually do to move the needle there?
The reason I closed my remarks with the issue of partnership is because states alone can't solve these problems, but states have a very critical role in setting the agenda, in setting the table, and convening the partners, and setting the strategic priorities. So, it's our job to get everyone aligned around this vision of affordable, quality health care, and then start digging in on the strategies for implementation. One of the strategies has to be around looking objectively at where the dollars are going. And variation, it's sort of a truism in quality work, that variation is the enemy, and we have variations both in quality and in cost. And we have to shine a light on those things, because until we do that, we don't know where the problems are that we need to tackle. So the OHS work on the benchmarking is really, as I said, a foundation to helping employers and the state and insurers know where the variations in cost are.
What is the status of that benchmarking work?
So the first report, so the benchmark was set starting for the 20 to 21 period. There was a 5-year benchmark set. And the first evaluation will be released early next year. The steering committee has been looking at where the cost growth has been highest, which is in the areas of hospital costs and pharmacy, and starting to think about strategies to start to rein in those costs.
What are your feelings about the public option? It's something that State Comptroller Kevin Lembo felt very strongly about, and several senators. It's been talked about for years as a way to make health care more affordable. What are your feelings about that, and will that ever come to life?
Well, I think there are a lot of different ways to tackle this, and the governor has asked me and his team to really dig in and start to look at what some of the most effective strategies are. There aren't a lot of places where a public option has taken off, but I do think that is something that we should continue to explore and understand ways that we might address some of the concerns that were brought up in earlier conversations, and see if that's a path that might get at the governor's goal of affordable health care for everyone.
And this might be premature, but do you know how Connecticut stacks up to other states as far as health insurance? I mean, we hear all the time everything we pay is more expensive. I mean, is Connecticut in line with other states or not?
The Northeast in general is very high in healthcare costs, but Connecticut is, we're about 9th when it comes to healthcare costs per person overall. So that's in part because of the region in which we exist. But, that's something that we've got to tackle.
Barton Reeves,
Yes.
would you care to tell us what perspective you're going to bring to one of the state's larger bureaucracies after having undergone the experience of launching a new entity and interacting, I assume, with that very bureaucracy at times? So.
I have at times, and the first thing I'll say is that Commissioner Gifford and her team were extremely cooperative and helpful in the ways in which we really needed their support in order to get the Paid Family Medical Leave Insurance Authority stood up. As many of the things that the Commissioner mentioned, I think, will be the focus of the first few months of my work. What I've learned in what I've done, and not just over the last 2.5 years, but over the last 22 years, is that it's really important to listen to constituencies and understand what their needs are. And one of the ways in which we can do that, as the Commissioner mentioned, is to really improve the way in which we communicate with our constituencies. So I will continue to work on the initiatives that have already been set to improve communication, whether and whatever technological solutions there are for that particular type of communication to happen. So that would be the first thing. The second is that, and I thank you, Governor, for your compliments as a leader, but one of the things I've learned over time as being a leader is not to make any assumptions. It is important to step into an organization to learn from those who have been there and to have an opportunity to respect the work that has been done and then learn where improvements can be made. So one of the things that I will do, that's one of the first things I will do, is I will make it a point to get to as many of the offices as we have so I can understand what the challenges are and then be able to create a thoughtful, effective plan to address them. I tend not to think about large agencies as bureaucracies. They've grown in ways that were responsive to the needs of the people at the time that they became. So there may be some changes, but they need to be made in a very thoughtful manner, in a manner that that advances the mission of the organization, but mostly what's most important is that it meets the needs of the people it purports to serve. So that is how I will take the skills that I've learned being a CEO at HARC and starting up Paid Family Medical Leave and moving them into a large organization on a different scale.
Governor, can you maybe make a comment? There have been a lot of changes over the last several weeks. This is your second term. Why should people at home care to know new agency heads, and what does that mean? Because I think people don't necessarily understand how this all works up here. So why is it important?
Because the second term is a fresh start, and we learn a lot. And when it comes to healthcare, which is what we're focused on today, people got to know that we're hitting the high cost of healthcare head on, and also emphasizing quality along with affordability. And this reorganization is one way that we can get there, I think, a lot more effectively than we can do it otherwise. And you know, what Paz calls a bureaucracy, I call a streamlined service provider. But just different ways that we can make delivery of services faster, quicker, and easier for our customers. And that's the way I look at life.
And as far as the other agencies that have had turnover, the message to folks out there that gave you an opportunity to run a second time or to have a second term, what's the message to them? Is this going to be a shift in policy with these new people, or like you say, is this a fresh start across the board?
Yeah, I think it's less about a change of policy. Deidre is not a change of policy. She's just got a broader portfolio that allows us to get to the end zone a lot faster and more effectively. Andrea, with her incredible management skills, building off of what Deirdre's done at DSS and making sure that bureaucracy becomes even more effective at delivering services to people in need. Did I answer that question?
Not really, but that's your answer.
Never ask a question you don't know the answer. It's okay.
Do you play any role in naming her successor? Is that Ms. Barton Reeves' successor? Is that
Leaves the board, but go ahead.
Because the Paid Leave Authority is a quasi-governmental agency, it has a board. So the board will actually make any decisions regarding successors, whether it's interim or permanent. Their first meeting to make that decision, at least to start to consider that decision, will be this Friday, and they will be doing that. And then from that point forward, it's really up to the board to make its final determination about succession and leadership.
And her position is subject to confirmation at OHS. Is that also subject to legislative confirmation?
I think so.
You think so?
I hope not, but I think so. Anything else?
Time for off-topic questions,
Can
Governor?
I ask a question about something that's happening later today, right? So when in the state of Connecticut we
Hang on,
have,
Sue.
sorry.
Are there any more on-topic questions?
Just one. How much of this new management setup arises from what lessons were learned during COVID, where, you know, the administration did a lot of things on the fly. Commissioner Gifford had some form of really what you're doing as far as sort of having some group responsibility. So anyway, how much did any of this arise from what was learned during COVID?
Look, I knew coming in that this was a state government that wasn't working as effectively as it could have, because you have all these independent entities, sometimes working across purposes, sometimes working together. That's why we created the role of COO, Chief Operating Officer. But to your bigger point, you're darn right. COVID really accelerated everything we had to do. We had the Emergency Operations Center. I had all the commissioners on, virtually every other day during the worst of COVID. All of a sudden, you realize why Deidre's got to be talking to, corrections, all these relationships. You realize what ties you together, and so I think that has accelerated what we're trying to do today.
All right.
Thanks, everybody. You want me to stick around here, or?
Yeah.
Yes,
So you want to jump right into off-topics?
I think so.
Yeah.
We'll let the Barton Reeves fan club.
I wanted to ask about the marijuana program.
Get Greg Comer here.
Yeah, where's she going?
I'm
We need
not
her.
staying right here.
Okay.
They're having, what is it called, the Cannabis Chamber of Commerce. Did you ever think we have that? But we do. The program's a little bit delayed. What do you understand about that? I think this is a way to get to know the growers. There's an equity portion of this, right? So it makes it a little different from other states. I mean, are we getting closer to the actual sale and retail operation?
I think we get going, don't we? First quarter of next year. Do you want to take that, Andrea? Come on up. Don't be shy.
Certainly the first quarter of next year. As the legislation states, we need 250,000 square feet of growth space in order for the market to start. We have finally gotten to that place. So we expect to announce very soon that there will be the 30-day window to launch the market.
And is the fact because of the whole equity portion is a little bit different in our state, that's made it a little bit more complicated to roll out as quickly, or?
I would say so, right? So the governor's vision was to make sure that this was an equitable program. So for every one license, there has to be a social equity license. So there's one-for-one parity. And because of that, the social equity lottery preceded the general lottery for these license types. And it takes a little while, because if someone applies through the social equity lottery, they are deemed not to meet the social equity criteria, they then have the option of going into the general lottery. But at the same time, we then have to have another lottery number picked to determine if that next person or that next applicant meets the social equity criteria.
Is there a monetary figure? I mean, I understand that the states and other states benefit more from taxing and stuff. Connecticut will benefit from this, but not to that level. Do you know what the revenue is for the state of Connecticut from retail marijuana?
So I can tell you currently there is about $41 million in the account from a revenue standpoint. Obviously that will grow. Part of it will go to the general fund. Part of it will go to the Social Equity and Innovation Fund, which is designed to reinvest in those communities that have been most harmed by the war on drugs.
Thank you so much.
Sure, thank you.
Governor, in concert with that, OPM was saying that it was going to take about a year to actually clear those marijuana convictions. And I've been asked to ask you, what are you guys talking about that maybe makes that happen a little faster? And is there going to be a creation of a clean slate office to help implement some of this?
So Jody, my understanding is those marijuana-related convictions, we're going to get that clean slate done very first part of next year. There are also some low-level felonies that the legislature implemented. They may take a little bit longer to make sure we get that right. But a little like marijuana, when it comes to low-level felonies, I think it's really important that we get it right.
Governor, some community advocates and legislators had a press conference this morning in New Haven talking about the clean slate delay. What's your understanding of why that happened? The bill passed a year and a half ago, I think. And when do you think it might be implemented fully?
Well, again, I think for all the marijuana-related convictions, we're going to be able to take care of that in the next 30 to 60 days, and that's 50,000 convictions. That gives a lot of folks a second chance right now. Some of the slightly more complicated ones take a little more definition, requires a database to make sure that's working. So you didn't get that done overnight, but it will be done, I believe, in the first half of this coming year.
Okay, because I think they're looking for a commitment this morning from the administration on when they might expect. So you think by June or so, by summer?
For the
non-marijuana?
For the non-marijuana, I believe that's right.
On that topic, they're just so concerned that this will delay job applications and opportunities for many people who do have records. What is your message to them about their concerns?
The vast majority of folks are going to have their marijuana-related convictions, which is the vast majority of the convictions, cleaned over the course of the next, say, 60 days. This has been sort of something that's been discussed for the last 20 years. We got it passed in the last year, and we're going to make sure that this is properly and appropriately and safely implemented. And as I just said, I think we'll have it all done over the next 6-8 months.
During one of the debates in the campaign, you mentioned that you would like to revisit the assault weapons ban and kind of take another look at the grandfather provisions that they passed after Sandy Hook. Is that still on your agenda for the coming session?
Yeah, I think it is. Is this guy carrying an assault weapon? Is that grandfathered, or is that something he's got, illegally? I think it would really, it's something that we can enforce, and I think it's something that we ought to do. I think it's a loophole that makes our society here in Connecticut a little less safe.
Have you had discussions with lawmakers? Do you plan to propose a bill? What's the path forward?
Yeah, I think we will be proposing a bill. We have had discussions with lawmakers.
All right. Thank you, Rick.
Thanks, everybody.